proceed here?
Well, I think writing an interim report would be very helpful. It would help to focus the committee on what they heard during those first 4 meetings, and it takes the study in some easier to consume bites. So, I mean, we're fine to go ahead and start to draft an interim report. If the committee wishes, they could also go the way of each of the members submitting what they hope to be in the report. That could be submitted through the clerk.
You're muted.
Sorry, it's usually better that way. So thank you, Sonia, for the information. I see that Mr. Van Bynen, you have your hand still up, or do you wish to speak again? You're muted. Okay, we have next Ms. Rempel Garner. Go ahead, please.
The testimony that we heard from witnesses today was deeply impactful for me, to the point where, like, I'm sure some of my colleagues on today chair were likely almost brought to tears. The impact of the pandemic is felt across political stripe, demographic in this country, and I guess, you know, I'm sitting here trying to manage news that the Moderna shipment of vaccines has been deeply cut today. We've got more restrictions on Canadian civil liberties with no end in sight. The EU is looking at trade restrictions on vaccines. Like I'm actually just trying to manage all this news. And what I don't want to have happen with an interim report is that the government uses that as a way to stall witnesses on vaccine delivery or the ministers in front of committee next week on vaccines. So I don't mind if the analysts want to start writing an interim report, but if this is what this committee is going to do, then they can expect the fact that we are going to be providing recommendations as a committee on vaccine delivery. We're in a national crisis. Like I'm just on a Friday afternoon with no makeup on, trying to absorb the fact that our country is not in a position to be receiving vaccines anytime soon. And what I don't want to have happen is that our health committee, the federal standing committee on health, in the middle of like essentially a wartime effort when we don't have vaccines, that we might be wasting meetings, deliberating like punctuation on a report that's not material to getting tools that is going to end this pandemic. So if that's the intention of the Liberals on this committee, it is a no-go for me, and it's a no-go for the Conservative Party. I don't mind if analysts want to start writing stuff up, because I do think that the mental health impact of the pandemic is fine. I'm going to look to colleagues, particularly on the NDP and from the Bloc, that if we're going to, you know, support a interim report on mental health, that the deliberations on the report would happen outside of the meetings that are scheduled on vaccines for the next couple of weeks, or over the break. If we wanted to deliberate a interim report on mental health, I would suggest that this committee do that over the parliamentary recess, not during the regularly scheduled meetings that are coming up on vaccines. This committee needs to work across political stripe to encourage the government and come up with like bold moonshot positions to get our country vaccines. You know, as I'm sitting here, my phone has just been blowing up today being like, when are we getting vaccines? And me going, I don't know. The government won't say. They say September, but it's not looking great. So that is, like, just bluntly put, that's my concern. I don't think we should be passive aggressive on this. I think, like, if the Liberals want us to be taking meetings away from a vaccine study, I do not support that. There will be no improvement in mental health of Canadians unless we get vaccines, rapid tests, therapeutics, and variant testing capacity to every Canadian. So I'm not sure if any of the rest of my colleagues have this opinion. I would like to hear it, but I do not want to take committee business or meetings away to be looking at punctuation on a report when we need to be getting vaccines to Canadians.
Thank you, Ms. Rempel Garner. We go now to Mr. Barlow. Please go ahead.
Thank you very much, Mr. Chair. And Ms. Rempel said much of what I was going to say is, you know, I understand Mr. Van Bynen's motion here and what he's trying to achieve, but I don't think that this report should, you know, if the analysts have the time and they are able to manage that and they want to work on that in their own time, I could understand that, but that motion or that report should not in any way interfere with the ongoing study of this committee into what is now going into vaccines. You know, we've heard from the witnesses as part of the mental health study that one of the root causes of people's stress and mental health anxiety right now is, you know, not knowing when access to vaccines is going to be happening, you know, no home-based and rapid testing. You know, if we really want to address people's mental health, we have to give them some answers. And those answers right now, the most critical thing is vaccines and where are they and what is going to be the distribution plan. So again, I have nothing against Mr. Van Bynen's motion as long as that study in no way impedes on what this committee is going to be doing next into vaccines. And Mr. Davies may have a further point in the fact that, you know, the NDP's priority is going to come up after the vaccine study. So he may see that as equally as important as the Conservative members on this committee feel on the vaccine. But I agree in that mental health, the impact that on mental health as a result of COVID is immense and profound. We've all heard that from our witnesses. We've seen the statistics that have been released. We saw the suicide numbers from across Canada as a result of an order paper question released yesterday. And Alberta, in my province, was the highest, second highest in the country behind Ontario. So we understand the impact this is having. But the root cause, the number one priority with Canadians that I think all of us are hearing right now is vaccines. Where are they? And unfortunately, the news just keeps getting worse and worse and worse every day, where, you know, our Alberta Health Minister came out earlier this week saying we are getting 0 deliveries this week, and our delivery access from the feds, we've been told, will be reduced by 80%. 63,000 fewer vaccines are going to be provided to Albertans in this quarter. And that is just unacceptable, and we need answers. So, Mr. Van Bynen, I appreciate your push on the mental health aspect. I support that. But I cannot support this motion if it in any way impedes our study on vaccines. Thank you very much, Mr. Chair.
Thank you, Mr. Barlow. Mr. Davies, please go ahead.
Thank you. Yeah, it's hard to debate this specific motion after hearing such impactful testimony. But what I want to do is sort of broaden the discussion. We've been studying COVID since last February, and we heard a lot of evidence on a lot of subjects between February and now. And of course, with the prorogation that ended that evidence, and if my memory serves correct, we adopted all that evidence when we struck the new committee, and we carried on with our study. My concern is, as impactful as the evidence we've heard over the last few weeks on mental health is, we've heard a lot of impactful evidence on a lot of issues. And I'm concerned that selecting one issue out of all of the different subjects and important areas that we've heard and then to occupy the committee's attention on that one particular issue doesn't do justice to many of the other issues we have, and it kind of prioritizes one particular issue out of these things. And I think a very strong case has just been made by Michelle and John that if an interim report were to be issued on anything right now, it probably should be on vaccines. And then the next thing. And so I don't think it does violence to anybody's position that all of these issues are important. It's just the real question before us is, in the middle of this report, in the middle of this study, do we really want to stop and isolate one aspect of it and then devote very precious and scarce committee time to that particular issue? So I think I can say at the same time, I think mental health is extremely important, but I don't know that it stands alone among all of the issues we're facing in COVID as being the issue that we should stop and focus on. With respect to Michelle's case, I always admire her work ethic. I think I'm starting to understand why she was voted the hardest working parliamentarian. I'm not as hardworking, I don't think. Actually, the truth is that we're really stretched. I mean, we have 2 committee meetings a week. I know some of us are on more than one committee. I'm also on the National Security and Intelligence Committee Parliamentarians, which also meets 4 hours a week. Plus, we have our caucus meetings, and we have our question periods, and we have our constituency work as well. So and of course, maybe it's my unique situation along with Luke, but we're just one on this committee. And so there's no substitutions allowed, and there's just the one of us. So I don't think the answer is to develop more meetings. That would be very difficult to schedule. So what I'm going to suggest is that maybe, and it's up to Mr. Bynon, but I'm wondering if you might consider withdrawing the motion and or tabling it, and we could reconsider this maybe after we've heard at least the first priority of each of the parties on this study. I mean, we've just completed the first theme, which is the Liberals chose mental health. Conservatives are choosing vaccines. The NDP and the Bloc's issues are yet to come. And I thought maybe at the end of that first priority, because we have 4 each, perhaps we can revisit this idea there. And maybe at that time, we could review the major themes that we've had and at that point consider doing an interim report, which I think is not a bad idea. But perhaps we can pick 4 or 5 or 6 or 7 issues that we might want to select out of the many issues that we focused on over the past coming up to a year, and issue an interim report, but not just on one particular issue, but on several. And perhaps that would be a logical break time for us to kind of consider the wisdom of doing an interim report.
Thank you, Mr. Davies. Ms. Sadu, please.
Thank you, Mr. Chair. I just want to remind the committee, I think we scheduled the witnesses. There's no wish to, this is just to, it's 1 year work. We just want to, and it will take time for the analysts to do the report. And the ministers are coming. We are all willing to do vaccine study, and witnesses already scheduled for next week. Thank you, Mr. Chair.
Thank you, Ms. Sadu. Mr. Van Bynen, go ahead.
Thank you, Mr. Chair. Let me be clear that there was no intent to delay the study on vaccines. I think that's an important issue that I think we all want to make sure that we study. And so looking at options on how we might do this, I note that the analysts had indicated that this would be helpful for them. And going back over materials and things that we've heard a long time ago, it makes it difficult for us, I think, to capture what we've heard in these last number of meetings. And I appreciate, and I had in mind that if need be, I'd be quite willing to participate in additional meetings, as was suggested by Ms. Rempel Garner during the recess. That was a very welcome suggestion on my part, so that we could go forward, capture the essence of what we heard. And frankly, I think it's a good idea to do the same thing for vaccines and any of the other programs. So I think there's a real benefit for us to do it. And if we can find a way to make that happen,